those errors so that they don't perpetuate and cause us disease and dysfunction. And also, when we're exposed to stress or toxic material or radiation, it can increase the error rate because those things can affect the chemistry of the replication and they affect the structure of the water. I mean, water is a really important aspect of this because the DNA itself, for example, when the water is structured, there's a column of DNA of water that runs inside the helix and is critical for it functioning proper in a chemical way. So if we have some kind of toxin or stress or radiation that disrupts the structure of the water, it can actually perpetuate more errors when there's replication and transcription to make RNA. So that's a really good point. Now, the other point I want to mention is also related to the test being wrong. So when they do this PCR test, they're actually using a probe, which is only a short stretch of the sequence they're looking for, that will attach to the genetic material that you want to find and basically be like the start of adding more bases on and duplicating the sequence exactly. And that probe, so basically the probe is the only thing that will match up with what you're looking for. And some of the probes used in the COVID-19 are only like 20 to 26 base pairs long. So if you think about it, if we have a stretch of 3 billion base pairs, right? I think that somewhere in there, you're going to find every single combination of 26 base pairs. So you're going to, I mean, it's impossible not to be there. So it would be easy to say that you think this sequence is specific to some virus that you think you found, but it could very well just as easily be a piece of our own DNA that has the same exact sequence.
It's a self-fulfilling prophecy is what it sounds like to me.
Yes, that's certainly one way to look at it.
Thank you. Anyone else have anything? Please speak up.
I have 4 questions. So my first question is, when you say the 45 cycles is the sort of upper limit that's going to start to give you results that aren't necessarily indicative of anything, does that add to the 80% likelihood of false positives, or is that part of the 80% false positives?
Right. Well, I don't think that the team that did that estimation really took into account the method of the PCR when they did that rate. What they were trying to look at is people that tested positive, they could follow them out and see if they got sick. But so I look at it as a separate source of error. Now, certainly it would, if you could accurately measure the error rate, if you had a gold standard comparison, it would be reflected in whatever error rate you calculated, right? But since we only have an estimate and it didn't account for it directly, it could be considered as an additional source of error. But it's really, really difficult to know what the magnitude of that is because we have no comparison. And then we also have a situation where there are different protocols that are run in different laboratories in different countries. So I found a protocol from the World Health Organization that is described 45 cycles. But that doesn't mean that if you go to Taiwan or if you go to Sweden or if you go to Mexico, that they're doing it exactly the same way. It's the same thing with the probes. They list, I think, 7 different probes that you can use. And so you have some choices there as to how you go, and it's just going to be like heterogeneous. And I think a really good example of comparison is the HIV test, which is also quite problematic and has many, over 50 conditions that cause a false positive, including pregnancy. Wow. And so they've done a test where they have one person who has already been documented to be HIV positive, and they take their samples and send it out to like 10 different laboratories and see, do those results agree? And what they find is that they do not agree, that they are sometimes negative, sometimes positive. And they've even done this where they've repeated it over time. So they have that person do it one time, then 6 months later, say, they take samples and send it out again. And even within the lab with the same sample, the result is not consistent over time. So in other words, you take my blood and test it now and it's negative, and that, or it's positive, and then tested in 6 months, it's negative. The same blood sample, same person, right? And I didn't do anything different. So it's impossible to tell right now how much of this error is going on because there's so much panic and urgency to everything. And you know, there's certain things like it's really hard to find information about this test, actually.
Okay, thank you. And there's a couple of the pictures of the exosomes and the virus, and the size, the scale is different. But that you were saying they are actually the same size. It's just the scale is reported in different units, I guess.
Yes, that's it. So there was one where there's it's reported in one is 500 nanometers, and the other one it's 5 micrometers.
Okay.
Those are actually it's the same exact length. Yeah, they try to make it as confusing as possible by not using standards. So I had a scientific calculator that I was using quite a bit to prepare this lecture.
Yeah, because I don't know those units, so that's good to know. And then, what would you say to people who are saying then this seems transmissible? Are exosomes transmissible, or is this, how would that be happening if it's not sort of our traditional understanding of a virus?
Right. Well, I don't think this is really known. So certainly there are exosomes in our body fluids, right? And if they're in the lung fluid, then when you cough, they're coming out of your body, right? So there is some possibility of this. However, think about the function of the exosomes. The exosomes provide a helpful function. They signal to other parts of your body that there's danger and how to deal with it, right? Or they actually even eat up those toxins. Mm-hmm. So if they were transmitted between people, it could actually perform a symbiotic type of function, a beneficial function, that it could help prepare other people that you might face the same toxic exposure. So you should prepare yourself for that. Now, that has not been, there's no studies that I found that show that. So this is purely my reasoning based on what I do know. I can't say for sure. But I do want to say one other thing about that given the size of these particles, that they are so tiny, there's really no way that you can prevent them from getting out or getting in. Right? So, if you look at the pores of the masks people are wearing, they're way bigger than the size of these particles. Yeah. So they're essentially just going to go right through.
So, yeah, because I just was watching something where the professor was describing it as like if you, saw a group of dolphins getting sick, and would you go just pick one dolphin and start cutting it up and looking for things? Or would you say like, wow, there's probably something in the water. Let's test the water and find out what's in the water. And so that's kind of similar to this, is maybe it's not transmitting, maybe there's a whole section of our world that's got a certain toxin and we're responding to it accordingly. But last question, wasn't 5G deployed in Wuhan just before all of this started affecting people?
Yes, I believe it was. Okay. And, I know that there is a lot of speculation and a lot of people actually with very strong opinions that feeling that 5G is the principal insult that has caused people to be sick. Now, I don't want to say, like, I think that this is a real possibility, and certainly there is a lot of correlations like that there's an installation and then there's an illness, and I think in Italy you can also find a similar pattern. But I think it's important to know that correlation does not prove causation. Right. And that there's really not quite enough evidence right now to say that with any conclusive opinion on it. But I definitely think that it merits a lot more investigation. And, I am very concerned about this deployment of 5G, that even if it's not the cause of this problem, it's going to be the cause of a lot of problems in the future.
Agreed. That was my last question.
Well, I would also, correct me if I'm wrong, sorry to jump ahead here, but this is a proof that your immune system is doing its job, right? Like if you test positive for exosomes, that's like, yeah, your system is working. Am I wrong about that?
Well, I don't think it proves that your immune system is working, but it definitely proves that your body is reacting to something and trying to function to heal from whatever that insult is. And interestingly, there have been, so remember I talked about that lock and key mechanism. So there have been other studies of exosomes showing that they have the lock for certain immune cells. And they are strongly felt to actually play a role in helping the immune system fix some of these problems. So that's an excellent point, James.
So it sounds like that you've isolated what it is not, but do we have an idea what it is and what they're supposedly these people are experiencing?
You mean what is the real cause of the illness?
Yes.
Yeah, so that's really, really difficult to say because there aren't really any scientists doing any research experiments looking for another cause. I will point out some interesting things that I heard in addition to the 5G hypothesis, but from Dr. Cowan, who, Lindsay, by the way, he's the one that made that dolphin analogy.
Oh, yeah, cool.
And he was really helped me think about this in this big picture way. But so he mentioned that there was a community, and I think this might be in Northern Africa, but I could definitely be wrong. It was definitely in a developing country where they had just recently made people use biodiesel for all of the vehicles, or they rolled out a big fleet of vehicles using biodiesel. And so he was reasoning that probably, this is like from corn or other GMO crops making this diesel, so that when these vehicles are using this fuel, they're actually putting out tons of glyphosate into the air. And then people would be inhaling this possibly, and then that could be a cause in that area of a respiratory illness. So it's quite possible that it could be multiple different causes in different places, and which also would help account for a slightly different constellation of symptoms that might be segregated in certain areas geographically.
So is this really nothing beyond a flu per se? Like the things that we're seeing, is this just a flu and they're saying it's this other thing? They're just taking all of the flu things that are going on all over the world and saying, oh, it's this one terrible thing and we have to stop it.
Right. Well, that is certainly a possibility. And, that has been my main working hypothesis so far, because if you look at the number of cases and the number of fatalities, you'd see that it doesn't even really rise to the level of the flu. So if they took the real number of flu cases for this year and decided to designate a certain portion of those people to test positive and say that when they're having the flu, it's actually this other really scary virus that is more likely to kill you and that we need to take all these precautions, that everything could certainly be explained by that, because when you have the flu, you're definitely going to put out these exosomes, and so you can have a positive test.